Hello, my name is Dominic Cancilla, and I will be doing my report this week on a 67-year-old female going through active opiate withdrawal. She was taking 4 to 5 15 milligram Percocets per day, snorting and taking orally. Her last use was 2 days prior to her admission. She also has a history of Xanax ingestion, three 0.5 milligrams per day. She's no longer on this. Um, both uh, both medications started out as a prescription for her. Um, she had a history of about 20 years ago getting a prescription for pain treatment after knee surgery, surgery to both her feet, hip surgery, shoulder surgery, and she was telling me the max that her prescription was that she was getting was 280 15 milligram Percocet per month. So she was talking to me like from the perspective of how would I not develop an addiction. The doctors did this to me. It was interesting perspective on how drug addiction can develop, even with prescriptions. She ended up not being able to get the prescription any longer. She said a few years back when there was a huge cut down on it, she got sent to a pain clinic, and they weren't able to get her in for a while because there was a lot of people that this happened to going to a pain clinic. She ended up turning to getting opiates on the street any way that she could because she literally could not stand the withdrawal that she was going through, she said. Um, Currently, she brought herself into the hospital to go through withdrawal. She has went through detox in the past successfully, but she relapsed. She has a medical history of COPD, asthma, and hypertension. Um, Currently, she's tolerating food well. She slept on and off throughout the night, but that is her baseline. She reports her mood is okay. No thoughts of harming herself or others. Medication that she is utilizing currently for her withdrawal is Suboxone. Um, she does bring up concern about this going forward for treatment. She's worried about just ingesting another substance, being just replacing one addiction with another. Our doctor talked with her and kind of explained that this isn't a perfect treatment, but it is a treatment and a step in the right direction towards helping her. And he's explaining that patients who choose to wean off Suboxone prematurely or per their own recognizance, there's about an 80% relapse rate back to the drugs. And she, like, almost too quickly became agreeable with, oh, okay, I'll stay on it then. Um, the My preceptor was also explaining that when someone who is in active withdrawal, active addict, their mind has things that they make up. And like in her situation, he wasn't surprised that she changed so quickly back to being agreeable. He's like, she most likely will circle back to fixating on, oh, I don't want to take this Suboxone. Um, and we'll have to see going forward. She may not be compliant, but as of now, we're just encouraging and working to set up outpatient treatment. And that is my report this week. Thank you.